A recent study published in the Journal of the American Medical Association found there's been an increase in the number of outpatient visits by physicians for mental health and substance abuse.
That's right, doctors seeking medical help themselves. And to shed some light on this topic, we've invited Dr. Bill Haining, Emeritus Professor of Psychiatry at the John A. Burns School of Medicine. And thank you so much for joining us, Doctor.
My joy, thank you.
Thank you. And you know, you specialize in addiction medicine, addiction psychiatry. That study we spoke about is a national study. It's kind of alarming to hear that our doctors could be dealing with mental health issues and substance abuse. And do you find that's also the case here in Hawaii?
Well, I think the other way of looking at it is that they're seeking assistance for their mental health issues, which is what you want them to be doing. It is very much the case here, and I spend a lot of time with physicians of my ilk elsewhere in the continental U.S. or in direct communications, and the prevalence rate is pretty consistent from place to place, really from race to race, between genders. The interesting thing is that it doesn't vary all that much from what the general population's risk is. If we look at the lifetime prevalence of having an alcohol use disorder, read alcoholism, as being somewhere in the vicinity of 14%, 11 to 14%, it's pretty much the same for physicians as it is for the general public.
And so, how does this differ from other professions as far as the amount of people who are affected by mental health issues and substance abuse?
Well, how they are affected, of course, in large part has to do with what resources they can call upon to help back them up in a time of crisis or difficulty. And interestingly, that's one way of looking at having a substance use disorder. It's profoundly impairing. It gets in the way of you doing what you want to do. Make a living, have a family, teach, anchor a newscast, whatever it happens to be. And so you have to divert a lot of resources into doing that. The issue I think that was being brought up by JAMA was twofold, and one was, does that scare the public to hear that physicians are seeking assistance for their anxiety, depression, alcohol, or other drug use disorder? And if so, what should the physicians be doing about that? What should the general, and can it provide a key as to what the general public should be doing about it?
And you know, what kind of help is there for doctors who may be watching this right now? Where should they go to get help? What if they're afraid to come forward, you know, maybe a stigma, or they just don't want people to know?
Sure. No, that's pretty common as it happens. But exactly because of the resistance of physicians to, I mean, the usual mantra goes like this, which is, gee, I can sense what the symptoms are of depression. I'm pretty sure that's what I've got right now. I need to get treated for this. Wait a minute, I'm a doctor, and I'm a pretty good doctor. Why don't I just go ahead and treat myself? And that ends up actually being a pretty shortcut way of getting into the hands of authorities. The physicians a long time ago realized that their responsibility to the public was to stay healthy. And they're a lot healthier now than they were back when I was a medical student. I will endorse that. So as a consequence, we've developed resources for the physicians that can in fact be generalized to the public. These are monitoring programs. The Hawaii Program for Healthcare Professionals, for example, HPHP, is a contributor-based organization that monitors, diagnoses, treats, and monitors, or arranges treatment and monitoring of physicians, in fact, of any doctoral level healthcare provider. But what they provide is a sample of how to do that right. And as a consequence, you find airline pilots, all sorts of organizations for whom the personal identity is really embedded in what they do. I mean, you don't want, doctors will do just about anything to preserve being doctors, including going into treatment, including being monitored, including all the stuff that a lot of people rebel against when it comes time to finally seek some help.
Could it affect their licensing process? Could it affect their licensing process? No.
Absolutely. It's built right into the statutes that, in fact, if there is an impairment, we have an obligation to each other to report that impairment and assist in seeking help for that. but the outcomes are really good. And so there's not an ethical problem in obliging somebody to go get care for this when you know that there are members of the public who are reliant upon a physician, or sensitive to his or her well-being.
And before we wrap up, is there anything else that you think that the public or physicians should know about this?
I'd like the general public to understand that this is the sort of resource that should be available generally. It's almost always a payment issue. It has to do with where insurance or the government kicks in support of this. But Steve Alm, currently your prosecutor, our prosecutor, at one point, of course, was a judge, had set up a project called HOPE, which was Hawaii's opportunity for probation and enforcement, and it used all of the same kinds of principles that are currently used for physicians in recovery, but it used it for that population who were in the court system. And these were not particularly well-off guys and gals or people who are necessarily out of trouble yet. But the outcomes for them were quite similar to the outcomes for physicians and the rest. So I suppose if I'd make a push, I'd say I'd push for entitlement to the same kind of care and support development of the same kind of care that the physicians presently benefit from. Ooh, that was a long-winded answer, sorry.
It was a good answer. We really appreciate it. And we really appreciate you stopping by tonight. An important topic and not often covered. So thank you so much, Dr. Bill Haining.
Thank you very much, Ms. Cuba. Appreciated the opportunity.